You open your patient portal and see a new laboratory result, A1C, 6.1%. The word prediabetes appears beside it. Immediately, questions start piling up. Does this mean you have diabetes? Did 1 week of eating badly cause it? Can you bring it down, and what should you do first? The most important thing is not to panic and not to ignore it. An A1C result can be useful, but it needs to be understood in context. A1C is a blood test that estimates your average blood sugar over roughly the past 2 to 3 months. It works by measuring the percentage of hemoglobin in your red blood cells that has glucose attached to it. That makes A1C different from a finger stick or fasting glucose result. A single glucose reading shows what was happening at one moment. A1C gives a longer-term picture, but it is still an estimate. It does not show every rise and fall, and it cannot tell you exactly what happened after one particular meal. In general, an A1C below 5.7% is considered normal. An A1C from 5.7 through 6.4% is in the prediabetes range. An A1C of 6.5% or higher is in the diabetes range, but one result does not always settle the diagnosis. If you do not have clear symptoms, a healthcare professional will usually confirm an abnormal result with a repeat A1C or another blood glucose test on a different day. Fasting glucose and an oral glucose tolerance test can sometimes tell a different part of the story. So if your A1C is 6.1, the correct conclusion is not, I definitely have diabetes. The better conclusion is, my average blood sugar may be higher than it should be, and I need to discuss the result and the next step with a qualified healthcare professional. If your result is in the diabetes range, or you have symptoms such as unusual thirst, frequent urination, unexplained weight loss, blurry vision, or feeling seriously unwell, contact a healthcare professional promptly. There is another reason context matters. A 1C depends partly on the normal life cycle of red blood cells. Recent blood loss, a blood transfusion, iron deficiency anemia, kidney failure, liver disease, certain hemoglobin variants, pregnancy, and some medical treatments can make the result less reliable. Most people will not have one of these issues. But if your A1C does not match your other glucose results, your medical history, or what your clinician expected, that mismatch deserves attention rather than guesswork. Now let us clarify what prediabetes actually means. It means blood sugar levels are higher than normal, but not yet in the diabetes range. It is a warning of increased risk, not a guarantee that type 2 diabetes will develop. Prediabetes also often causes no obvious symptoms. You may feel completely normal. That is one reason many people discover it only through routine testing. The next common misunderstanding is that prediabetes is caused by eating sugar alone. Sugar-sweetened drinks, desserts, and heavily processed foods can certainly make a healthy eating pattern harder to maintain, but A1C is influenced by a much larger picture. Your genetics, age, family history, sleep, physical activity, muscle mass, overall food pattern, body weight where relevant, certain medications, and medical conditions can all affect risk. This is not about blaming yourself for one food or one difficult month. It is about identifying the parts of the picture that you can realistically improve. So, what should you do next? First, confirm what the result means for you. Ask whether the test needs to be repeated. Ask whether a fasting glucose test or another test would add useful information. Review any medical conditions or medications that might affect blood sugar or A1C. Also, ask when you should be tested again. Many people with prediabetes are monitored at least yearly, but the timing may be different if the result is close to the diabetes range, rising quickly, or accompanied by other risk factors. Second, improve the overall structure of your meals instead of searching for one perfect food. A useful meal usually includes a source of protein, high-fiber carbohydrate, vegetables or fruit, and an amount of food that matches your needs. That could mean eggs with vegetables and whole grain toast, Greek yogurt with berries and nuts, beans with vegetables and brown rice, or chicken with roasted vegetables and potatoes. You do not need to eliminate every carbohydrate. Carbohydrates include foods such as fruit, beans, dairy, whole grains, and vegetables. The goal is usually to improve quality, portions, and balance, not to fear an entire nutrient. Start with the changes that remove the most unnecessary sugar and refined starch from your routine. Replace sugary drinks more often with water or an unsweetened option. Reduce the frequency of large desserts rather than promising never to eat one again. Add fiber-rich foods gradually. Build meals that keep you satisfied enough to avoid constant grazing. Third, move more consistently. Regular activity helps your muscles use glucose. A strong long-term target for many adults is at least 150 minutes of moderate activity each week, spread across the week. Walking counts. But strength training also matters because muscle is an important place where glucose is used. 2 weekly sessions that train the major muscle groups can complement walking and other aerobic activity. You do not need to begin with an intense program. A 10-minute walk after a meal, a few short walks during the workday, or 2 simple resistance sessions can be a realistic starting point. Also, pay attention to long periods of sitting. A workout does not erase an entire day without movement. Standing, walking briefly, or doing a few minutes of light activity throughout the day can make your routine more active overall. Fourth, consider weight loss only if it is medically appropriate for you. For adults with overweight or obesity, even modest weight loss can significantly reduce the risk of progressing from prediabetes to type 2 diabetes. Major diabetes prevention studies used goals of roughly 5 to 7% of starting body weight, along with regular activity. But not everyone with prediabetes needs to pursue weight loss, and weight is not the only factor that matters. Focus on behaviors you can repeat, not an extreme deadline. Fifth, protect sleep and reduce avoidable stress where possible. Poor sleep does not single-handedly cause prediabetes, and stress is not a personal failure. But both can affect appetite, activity, recovery, and glucose regulation. A consistent sleep schedule, treatment for possible sleep apnea, and practical stress management support may be part of the plan. What about medication? Lifestyle changes are the foundation for many people, but medication may be appropriate for selected individuals at higher risk. Metformin is sometimes considered, especially when risk is substantial or glucose levels continue to rise. That decision belongs with a qualified healthcare professional. Do not start someone else's medication, change a prescription, or use supplements marketed as natural blood sugar cures. Natural does not mean proven, safe, or free from interactions. Here is a realistic first-month plan. Schedule the follow-up conversation. Choose 2 food changes you can maintain. Set a weekly walking target that fits your current ability. Add simple resistance training if it is appropriate for you. Track actions, not perfection. You might record the number of walks completed, how often you replaced a sugary drink, or how many meals included vegetables and protein. Do not check your A1C every few days. It reflects months, not hours. Give consistent habits time to matter, and follow the retesting schedule recommended for you. Prediabetes is important, but it is not a verdict. Your A1C result is not a grade on your character. It is one piece of health information that can help you and your healthcare professional make better decisions. The goal is not to chase a perfect number through fear, fasting extremes, or miracle products. The goal is to understand the result, confirm what it means, and build a plan that is evidence-based, realistic, and repeatable. If this video helped you understand prediabetes and A1C more clearly, please like the video and subscribe to Health for Legacy. Your support helps us continue producing careful, evidence-based health content without hype or misleading promises. Until then, live stronger, age better, stay safe, stay healthy, and take care.